Hello and welcome to this episode of The Heartbeats, the North East and North Cumbria Integrated Care Board's official podcast channel, giving you the latest news, innovations and health stories from across the region. Today, we're focusing on a subject that's incredibly important for expectant parents and those planning a pregnancy: vaccinations during pregnancy. Joining us are two expert guests from the South Tees NHS Foundation Trust, Alex Pine, a dedicated vaccination nurse, and Ellie Young, a specialist midwife. Together, they'll help us unravel the essential role vaccines play during pregnancy, from understanding why vaccines are vital to discussing specific vaccinations recommended during pregnancy. Thank you both for joining us to talk to us about vaccinations during pregnancy. So, can we start by just learning a little bit about yourselves? How did you end up getting into the roles that you're now in currently?
So I started vaccinating about 5 years ago. I started giving the flu vaccines to our staff members, and then COVID happened. I was doing exactly the same, and we were vaccinating all frontline workers. And then I seen this job come up about a year and a half ago, and it really took me. I was like, yes, I want to do this. I want to vaccinate pregnant women. I'm very passionate about it. And so that is how I came to being the vaccination nurse here.
So I'm actually the public health midwife, so I don't deal with just vaccines. I started here in this hospital as a volunteer, and I worked my way up from being a volunteer to a healthcare assistant, then a midwife, and now I am the lead midwife for public health in South Tees. So that's how I am working with the vaccinations.
So, the big question today: why are vaccines so important in today's society?
So we know that vaccines are really important because they prevent millions of deaths worldwide. We know that it's the biggest medical invention in history. And
I guess thinking about vaccinations, it is the best way to prevent ourselves from getting seriously ill, of course, sort of builds that certain level of societal immunity, presumably, yeah?
Yeah, that not just in pregnancy,
yeah,
in all walks of life. So babies are vaccinated 6 weeks after they're born and throughout their lives. And then obviously if they are female, when they're pregnant, they'll be offered vaccines then as well.
Why is being vaccinated during pregnancy important?
So we know that when you're pregnant, your immune system is weaker when you're carrying a baby. So it's really important to get vaccinated. Not all it's to protect you. The flu vaccine is to protect mum, but also the protection is passed to baby for the whooping cough and the flu vaccine, COVID, and then obviously the new RSV vaccine.
Is there a particular time during pregnancy when it's more important to be vaccinated, or is it just generally?
It depends on the vaccine that you're going to be receiving. So the flu vaccine is offered as soon as we know that you're pregnant. We would offer that straight away. The whooping cough vaccine is offered from 16 weeks of pregnancy. The new RSV vaccine will be offered in the 28th week of pregnancy, and the COVID vaccine also is at any point in pregnancy. As I said, each vaccine is a very different timescale as when we would offer it, but the most important thing is to get the vaccine. So if you, for example, the whooping cough vaccine is ideal to get between the 16 and 32nd week of pregnancy, but if you haven't had it in that time frame, we would still offer it at a later date. We would even offer it in the postnatal period to protect the mum from getting whooping cough, so she wouldn't be passing that immunity to the baby, but she would still be offering some kind of protection. Same with the RSV vaccine, that would be offered right up until delivery.
And the main thing is not to delay the vaccine. So if you were coming up to 16-week pregnant and you were offered the flu vaccine, please get the flu vaccine then, rather than wait until you're 16 weeks pregnant and get your pertussis whooping cough vaccine.
So why have these vaccines, why are they being recommended that they are given to those who are pregnant?
So the flu and the COVID vaccine are recommended for pregnant women to protect the mum from getting those illnesses. We know, as Alex said, that when you're pregnant, your immune system is weakened, so we want to protect mums from getting COVID and flu while they're pregnant. We know that if you do get COVID or flu when you're pregnant, you're more likely to be admitted into intensive care unit with respiratory problems. So we need to protect women from getting those illnesses. Pertussis and the RSV vaccine, we offer those to mums so that their immunity passes through to the baby and protects the baby. So when baby's born, we know that we can't give the vaccine straight away to baby. Babies get their vaccines at about 6 to 8 weeks of life when they have start their vaccination programme. So we know that by giving the pregnant woman the vaccine, the immunity passes through to the baby and protects the baby for those first few weeks of their life.
And where can pregnant women go to get these vaccinations?
We offer the vaccines here in the hospital. GP surgeries offer it, and some pharmacies, community pharmacies, women can get the flu vaccine there. Same with the COVID vaccine. We don't actually give that in the hospital here. I think some hospitals might. If not, it's again GP surgery or community pharmacy. That one as well is from as soon as you know you're pregnant.
So you've mentioned the new respiratory syncytial virus, or RSV, and which this vaccine will be available from the 1st of September. So can you tell me a bit more about RSV and why is it important to get vaccinated to it?
So RSV, it's a highly contagious virus. It's actually really common. But basically for our babies, it can cause bronchiolitis and lots of other severe infections such as pneumonia.
So it's important to get the vaccine to protect your baby. And I think women need to know that we're giving it very similar to the whooping cough vaccine. So the immunity from mum will pass through to baby and protect baby from getting these infections. Like Alex said, bronchiolitis and pneumonia are the main ones that we're hoping to protect and prevent admissions into our paediatric wards.
We know that for babies under 1, there was up to 900 ICU admissions, and that also there was 22 deaths annually.
And we know this year from whooping cough, already this year there's over 10,000 cases and 10 babies have died this year. With the flu vaccine, it's not necessarily babies that die, but we know that if you do get flu or COVID when you're pregnant, you're more likely to be admitted to ITU, and flu is one of the highest killers of pregnant women.
And I think it's also important for the flu vaccine, we know that protecting mum and baby, but flu also can be linked to low birth weight, stillbirth, preterm birth for mums and babies.
If you are pregnant, where and when can you get the RSV vaccine?
So we're offering the RSV vaccine to pregnant women from the 1st of September. You can have it from 28 weeks of pregnancy. Ideally, we want women to have it in that 28th week. However, we will be offering it right up until delivery because we know that we will still be giving some protection to baby. It takes approximately 2 weeks for the immunity to pass from mum to baby. So at any point, it's worth having the vaccine. It's like the whooping cough vaccine that can also be given postnatally because we know that obviously we're going to still protect mum from getting whooping cough, which would then prevent the whooping cough virus spreading. The RSV vaccine is not going to be seasonal like the flu, so we are starting it from the 1st of September, but it will continue. It won't be one that stops after the season like flu does. So any woman from 28 weeks will be offered that vaccine.
So looking at vaccinations in pregnancy, some people get nervous about getting vaccines, say, as one batch because maybe they're worried about side effects or, just generally having hesitancy about vaccines anyway. With all of these vaccines, can they be had all at once?
So the vaccines can be given all at once, but I think the thing to say is that please don't delay the vaccines, as we've already said. So your pertussis vaccine, obviously 16 to 32 weeks ideally. We would really like it within that time. And then we've said the RSV is 28 weeks and the flu is at any time. So as soon as you know you're pregnant, you can have that vaccine. So that's what we'd say. Please don't delay and think I'd rather them all together. And the other thing to say just about the side effects is that it's not a live vaccine. They're really mild side effects, the same as any other vaccine that someone would have had.
Another common question I'm sure you guys have encountered many times, but it is it safe to get vaccinated during pregnancy?
It absolutely is. We wouldn't be offering the vaccines if they weren't safe. So the whooping cough vaccine's been given since 2012 and has reduced the numbers of whooping cough in babies significantly. However, women refusing to have the vaccine lately has caused this huge spike in cases. So yeah, we know that all the vaccines we offer are safe. With regards to side effects, they're really mild. So some ladies describe flu-like symptoms, but really that is a bit of a headache, feeling a little bit sleepy, nothing more than that, and a dead arm. You'll get a sore arm, but that's as bad as it's going to get for the sake of protecting your baby.
Are there any sort of common myths that you guys hear when it comes to vaccinations during pregnancy? You know, are there any sort of recurring themes, shall we say?
I think about the flu vaccine, it is always that the flu vaccine will give you flu, and we always stress this is not a live vaccine, you will not get flu. But that is definitely one common one we hear quite a lot.
We get a lot of vaccine hesitancy, but really people don't give us reasons why. They just say they don't want it. They don't really understand why we offer it. They don't really understand why they're refusing it. They just decline. We get things like, I don't know, you're not sticking anything in me, I'm not being injected with anything, you know, you're not harming my baby.
Yeah.
And they're all comments that we hear all the time, and all we ask our women is to read up on, you know, trusted websites, speak to healthcare professionals to get the facts about the vaccines, because they are all safe. We wouldn't be offering them if they weren't.
Can the vaccinations make an unborn baby unwell?
So they definitely can, because they're not live, the mum won't get whooping cough, neither would baby. That's the same with flu, COVID, and then obviously the RSV. All it's doing is protecting, so the antibodies are passed through the placenta to baby to offer them that protection once they're born.
We're offering the vaccines to offer protection, not to give harm.
What are the most common side effects that pregnant women will experience after having these vaccines?
So usually a bit of a heavy dead arm, maybe a little bit of redness or swelling around the injection site. They might feel slightly more tired over the next few days, a little bit achy. Generally, that's about all.
It's a good excuse to have an early night if you're feeling a bit sleepy after you've had your vaccines. And I always tell ladies with the dead arm, it means they can't do any hoovering. So, you know, it's worth those side effects to protect you and your baby.
What then would you say is the key advice you would give any pregnant woman who is hesitant about vaccinations? Where can they go, or who can they speak to I guess, overcome any hesitancy that they might have about getting a vaccination during their pregnancy?
So I think as a pregnant woman, you would go through, obviously, you see lots of people, you come to your scan, you'll see your midwife. There is always healthcare professionals who you can interact with. You can ask the questions and you can speak about them and obviously get the advice. And we know that the NHS website has the advice about all of the vaccinations as well. So that's a good website for women to go to.
We hope that women are told about the vaccines as soon as they become pregnant. So at their very first booking appointment, they'll be given the information about the vaccine programme that we offer throughout pregnancy. We certainly give out leaflets at that point, so we would hope the women would go away and read those leaflets, educate themselves a little bit about what it is that we're offering and why we're offering them. If they then have any questions, they'll see their midwife regularly. They'll be coming into hospital regularly for scans. They'll see people like Alex, who's a vaccination nurse. There's so many people who can give them the correct information about these vaccines. And if in doubt, you know, Google trusted websites like the NHS website. That's where they're going to find the information.
It'd be kind of interesting to know your views on how much, from your perspectives, how much of an impact vaccinations during pregnancy has had on the general population. By having these vaccinations, is it making a difference? Is it making a tangible difference?
Well, I think by the amount of whooping cough cases that we've seen this year, it's obvious what a difference the vaccines make. So up until this year, whooping cough was something that was really rare. People didn't hear about it. And I think, again, that's another reason that women refuse the vaccine, because they say, well, I don't need it. We don't have whooping cough in our country anymore. But unfortunately, we do. So we know that women have been refusing the vaccines, and that's caused this huge spike in cases of whooping cough this year. And we've now had 10 babies that have died, which has been unheard of up until now. So that is the evidence that the vaccinations work.
So I guess what would be your key advice to anyone who is pregnant?
Just please speak to someone, a healthcare professional, if you aren't sure about the vaccinations. We know that obviously pregnancy is a stressful time. People have lots of worries. Please speak to someone, but also please get vaccinated. We're doing it to protect you and, most importantly, your baby. The vaccines are obviously free. And yeah, it's just so important. We're so passionate about it because we know obviously babies can be harmed if they do get these infections and viruses.
Yeah, I would tell women to just read up and educate themselves a little bit. By all means, if you still don't want the vaccine, that's fine, but don't come and just tell us you don't want it without a reason why. They're so important, and as Alex said, she is so passionate about helping these women to protect their babies. We just want to do our best for the women and babies in our care, and we know that the best thing to do is have the vaccines.
Thank you for listening to this episode of The Heartbeats. You can stay up to date with all of our content by following the North East and North Cumbria Integrated Care Board's YouTube channel or Spotify channel. Stay tuned for the next episode.